On this slide, I wanted to back up a little and see how this policy fits against the backdrop of the local health and justice ecosystem. So I've created what I'm calling a diagram of the 8 degrees of separation between Medicaid jails and counties. So it is intentional that it's kind of in a cyclical kind of shape here because it is kind of like a cycle. So let's start at the top. There are currently about 90 million people enrolled in Medicaid and CHIP as of about August of 2023. And counties serve as a safety net for those unable to afford medical care. So Medicaid is super important for counties to do the work that we do in terms of serving as a safety net. Those individuals who cannot afford health care end up really their expenses are on the cost of the county. So Medicaid helps us offset those costs. Not to mention the fact that counties pay into the Medicaid program as a part of the non-federal share, and we administer the program, doing enrollments and re-enrollments, as well as administering Medicaid services in local healthcare facilities. Medicaid reduces the frequency of uncompensated care and lessens the strain on county budgets, as I just mentioned. And it's also the largest payer of behavioral health services, and that's across all healthcare payers. So that is a pretty big responsibility for Medicaid to shoulder most of the costs, the expenses related to behavioral health in the country. County governments own and operate about 2,800 of our nation's 3,100 local jails. So the great majority of local jails are operated by counties. And approximately 70% of the local jail population are held pending disposition. That means individuals who are housed in the jail are likely pre-trial. They have not been convicted of a crime and have not gone through due process. And that's the good majority of the jail population. Additionally, approximately 44% of jail inmates have a major mental illness, and 63% have a substance use disorder. And there is a tremendous amount of overlap between the two, with jail inmates having co occurring mental illness and substance use disorder. So then that brings us right back at the top of this cycle here with those individuals who are enrolled in Medicaid and CHIP and often outside of the jail are receiving behavioral health treatment or chronic illness treatment under the Medicaid program, especially if you are in a state that has expanded Medicaid.